Ambulances race through our city streets and neighborhoods with sirens blaring every day. It's comforting to know we can call 911 in a medical emergency and have paramedics at our doorstep within minutes to provide life saving aid. But 50 years ago, the emergency medical services we rely on today didn't exist. In fact, most people needing emergency assistance were carried to the hospital in the back of a police car. In 1966, according to a study by the National Research Council, soldiers in Vietnam were more likely to survive a battle wound than accident victims in America. That changed in the late 1960s when a public health student and former part time orderly named Philip Hallen decided to create an ambulance service in Pittsburgh. His idea was simple: bring people to their doctor's appointments in order to improve public health. He approached a nonprofit organization called Freedom House and asked the executive director, Jim McCoy, to partner with him.
So he approaches Jim McCoy and he says, why don't we start this ambulance service? And McCoy, who had started Freedom House specifically to provide jobs for people living in the Hill District, which is almost entirely an African-American neighborhood, says, okay, you're on, let's go ahead and do this.
That's paramedic Kevin Hazzard, author of American Sirens, the incredible story of the Black men who became America's first paramedics. He says that while Hallen and McCoy hashed out their plan, across town, a doctor named Peter Saffer was working on a similar idea. Only he wanted to bring doctors and nurses out into the community instead of waiting for people at the hospital. He believed that providing pre-hospital medical services would give patients a fighting chance at survival once they arrived at the ER.
Saffer is indisputably a genius. He was nominated 3 times for the Nobel Prize in Medicine, more or less single-handedly invented CPR, was one of the inventors of the ICU. He's this guy who just could not stop innovating. Well, he's in Pittsburgh, and for some years now, he has been seeing that if you get sick outside of a hospital, there's no help for you. The people who arrive are either cops in a wagon or they're 2 undertakers with a hearse. But either way, all they can offer you is a ride. They have no training, they have no equipment to speak of. In most cases, they don't even ride in the back with you. You're just sort of picked up, slung in, and sped off. In fact, Saffer's own daughter dies of an asthma attack that began when she was at home. So he's very intent on fixing this problem.
Saffer approached other medical professionals with his plan, but they weren't interested in riding around in an ambulance. Undaunted, Saffer decided to train ordinary citizens with no medical background to become paramedics.
So he devises the world's first paramedic program. He literally creates it out of whole cloth. And if it were used today, it would still be perhaps the most intense program in the country. It's 300 hours of education. They're going to the ICU, the ER, the OR. They're in morgues watching bodies be dissected. He comes up with all these incredible ideas. In his mind, he's redeveloped the ambulance. He's come up with treatments and medications and training regimens. He has this huge spectrum of ideas that he's ready to unleash upon the world. The problem is he has no people. So he has this incredible idea, but nobody to carry it out. And across town, there are these 2 guys with all these people, but they don't really have anything for them to do. Well, they meet in the University of Pittsburgh, and that chance meeting becomes the spark that creates the world's first paramedics.
When Saffer and Freedom House joined forces, Hallen and McCoy assured him that they would find students for his new paramedic program. But the task was a lot harder than they'd anticipated. Many of the candidates had not finished high school. Others were Vietnam vets and had bounced between jobs for years. Some had families to support and couldn't afford to take time off work to go through the intense training program. It was an incredibly hard sell, but they were able to recruit 44 men, all of them Black. Only 25 completed the brutal training to become full-fledged paramedics. They even mastered the technique of intubation, one of the more challenging emergency procedures where a breathing tube is inserted through the patient's nose or mouth and then down the windpipe, all while riding in a fast-moving vehicle.
They originally started with 2 ambulances. They eventually got up to 3. They staffed them 24 hours a day, 7 days a week. Within the first year, they had, run thousands of calls, and that only continued to grow. Because again, initially, there was a lot of uncertainty about what they were, but over time, people are seeing what these guys are doing. And so they're saying, okay, well, we're going to call them for this. We're going to call them for that. And so as the community begins to trust them and understand what they're up to, more and more people begin to call.
As news of Freedom House paramedics spread across the country, other cities established their own emergency medical services, adopting many of the same techniques established by SAFR and the Freedom House paramedics. SAFR also founded the National Registry of Emergency Medical Technicians, which is still the national standard for EMS professional certifications today. Sadly, the Freedom House paramedics lost their funding when Mayor Peter Flaherty took office in 1970.
But ultimately, they were so successful that the city had no choice but to recognize that paramedics were, in fact, very successful and highly effective, and it's something that no city could afford to not have. And so Flaherty said, okay, fine, we'll have paramedics. We're just not going to have you. And so he cut the funding for a group of guys who had been practicing paramedicine in his city for 7 years at that point, and hired an almost entirely white force that had zero experience.
Despite the city's efforts to shut down Freedom House paramedics, Hazzard says many of the medics ended up joining the city's program and continuing their careers. Though the original Freedom House program ended, its legacy continues through a program called Freedom House 2.0. This project, launched in 2020 by the University of Pittsburgh Medical Center, recruits, trains, and employs first responders from economically disadvantaged communities. So far, 39 students have graduated from the program. Kevin Hazzard's book, American Sirens, is available now online and wherever books are sold. You can learn more about Freedom House 2.0 and all of our guests by visiting our website, radiohealthjournal.org. For more behind the scenes, search Radio Health Journal on Facebook, Twitter, and Instagram. Our writer-producer this week is Polly Hansen. Our lead producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
Really, since the 70s and 80s, it's become probably one of the most serious global crises that we're not talking about.
The rising death toll caused by antibiotic resistance.
Then, how can you stop negative thoughts from controlling your actions?
We fail on our New Year's resolutions, not because we can't do it, not because we don't have the right intentions, but I believe it's because our mind and our emotions get in our way.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Less than 10% of borrowers owe $100,000 or more, but they owe about a third of the outstanding debt.
Sadly, there's no one-size-fits-all solution to solving the higher education debt crisis. Then,
to think that New York, since 1790, has been the largest city in the country, remains the largest, but there's a reason for that.
The endless allure of New York. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more, and check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.